So here we're going to work the lumbar erectors in this child's pose position. Of course, some of our clients aren't going to be comfortable adopting this posture, but if they're not comfortable adopting this posture, that's going to tell us a whole bunch of stories, right? It could be they have hip issues, knee, ankle, shoulder, T-spine. This is actually what we call a resting position. So if people aren't comfortable resting in this position, you may have bigger fish to fry somewhere else. The reason we put Kiki in this position to release the lower back is if someone has a really large or pronounced lordosis, they're gonna have, come up quickly, Kiki, and so if Kiki stands like this, which she doesn't, but a lot of our clients do, the lumbar erectors are gonna be shortened. So we're trying to lengthen and release this tissue. So by putting Kiki like this, what it does, it posterior rotates her ilium, and it lengthens the tissue this way. So we're trying to add length and release the muscles in this position. So the lower back is commonly tight. And it's actually commonly weak. It doesn't have a lot of endurance in our lower back pain clients. So this is a great position to release these tissues. And I'm going to show you a couple of variations of doing this. First of all, we're going to work bilateral. So we're going to work both sides. I contact Kiki's PSIS. It's these two bony prominences down in the lower back. Commonly you see it as two dimples. I'm going to extend my fingers, I'm going to stand back, and I'm going to push 45 degrees, and I'm working towards Kiki's mid-back. So here we're just scanning, we're just seeing, is there any tissue adhesions? Is there any rotations? Is there any stress response from the client? Do they flinch? Do a couple of passes. PSIS, extended fingers. And working here, very light pressure. For me, it feels like Kiki has something going on the left side of her back. There's either a bit more tissue and or there's a bit of rotation. So here we're trying to add length, we're trying to get them out of their lordosis, that pattern that most people are stuck in today because of their lower cross syndrome. Now we're going to work one side. So I'm going to use thumbs, same thing, PSIS, straight thumbs, and I'm pushing down. So I want to be in that laminar groove. So of course we're working the erectors of the lower back, but we're also going to get deeper. Those second and third layer muscles, the multifidi, rotatories, etc. These are the ones that really cause deep somatic pain and dysfunction. Feels okay? Mm-hmm. I'm not working so hard here, guys. I'm using my thumbs, so I don't want to be working so hard. You can use the pisiform grip, this little bone here on your hand. I always hook here and I hold the pelvis or hold the hip. I get a bit taller and I sink this way. Same thing, hooking. So as I push my left arm up, you see Kiki's shorts move, because that's all that fascia is moving. So we want to hook that fascia down as we pull. And that's what prevents all those cross linkages forming from the interstitial layers of the fascia. So we're trying to break or dissolve fibrosis and adhesions. One of my favourite ways to release the lower back in this position is to use a soft elbow. So again, my elbows on the PSIS. I stand slightly to the side, and it's the same as the previous video. I look at my palm, and I slowly turn and look at my watch here. And what this creates is an ulnar fascial hook. So my ulna is hooking the fascia, and I twist and glide. Twist and glide. And here we will focus on the lumbar, the lower back. So no need on this particular technique to come much higher than sort of the bra line. Bra line sits about T3 or 4, I guess. So we don't need to go as high as that. This way. But very relaxed. I'm not making a fist. This is very relaxed. So I'm here. I'm standing back. My hips are back. Legs are straight. My hands are relaxed. I'm working down this way. So my pressure is always 45 degrees. I'm not pushing down. I'm pushing away. This way. Feels okay? Mm-hmm. And what I like to do is, once I get to the top of the erectors, I kind of scoop around and come back. Palms up. Once we get in there on the top of the erectors, my palms go together, scoop, come around. One more time. Looking at my palms. So it's most of my weight's on my left leg, and I'm generating pressure with my right leg. See how I'm pushing here? For guys who are pretty stiff, shoulders, and women, this is going to be tough for them, so I'll show you a variation. Palms together, push apart. You can start wider, so I'm starting now with my arms. So my first technique was my arms were here, now I'm wider, so that's going to allow me to get the outer part of these broad erectors. So it's like I'm clamping the erectors together. I'm going this way. We can work across the lower back in the same position. I'll show you this side for camera purposes. So I'm going to start with a soft elbow. Find the spine. It's pretty easy to find this position because the spinous processes pop up and we can see them pretty readily. So I'm here and I'm pushing away. As I push away, I stabilize the hip. Push away, stabilize. If we don't stabilize, the client starts resisting because they think they're going to roll. So I can even pull, push, push, push. And if you've got clients who are comfortable in this position but not completely 100% comfortable, in one of our live classes, some students actually, they were yoga practitioners, and they had like bolsters here and like a couple of other bolsters on their head, so they're completely relaxed. So of course, if you've got a client who you're apprehensive in this position, there's other ways to release the back, of course. But this form of bodywork is just a bit more restorative because we're putting these bodies in different shapes and bending and twisting. And that's ultimately what we need to do to restore movement, mechanics and pain, reduce pain. We need to improve people's ability to change shapes in their body, which traditional bodywork generally doesn't, right? Because it's either lying on your back or lying on your front. So we try to be a bit more dynamic about posturing and the way we set people up.